Welcome to the Natural Health Podcast, where we bring awareness of sustainable health in the business hustle space. Natural Health Podcast is perfect for the high-performing, business-minded individuals who want to work with their biochemistry to achieve optimal health. It's Wednesday, which means it's time for What Would I Do? In today's episode of Natural Health Podcast, we'll discuss this week's question. All questions are kept confidential and I read them and answer them as if it was me. Hence why it's called What Would I Do? The information provided is not to be taken as advice and is solely for information purposes only. I'm not here to treat, cure, or provide medical advice. I'm here to educate and inform you so you're able to take steps towards optimal health. Please discuss any lifestyle changes and medical changes or issues with your healthcare professional. Let's get into today's question. Thank you so much for writing in. I'm absolutely loving all the questions that are coming through. And remember, if you want to write in, get in touch with me at mahalo.ragoos on Instagram. Push through your question and hopefully it'll be answered on the podcast. Today's question is I know a few women like myself have stopped taking the pill to mask the symptoms of PCOS and are overwhelmed with all the information surrounding a natural cure. Is it possible to reverse the symptoms of PCOS? Perhaps you could explain how gluten, sugar, and dairy affect women with PCOS. Thank you so much. Well, let's get straight to it. The thing is I can't treat, cure, or diagnose any type of things, right? So we're unable to treat PCOS, right? But I'm going to give you information on PCOS and the links with gluten, sugar, and so forth. And then hopefully you'll be able to get in touch with your healthcare professional who'll be able to assist you to put a treatment plan together in regards to the PCOS symptoms that you may be experiencing. But let's get into actually talking about what is PCOS, right? It's actually polycystic ovarian syndrome. So that's what it stands for, right? It's an endocrine disorder that potentially affects about 1 in 7 women worldwide. So there's a lot of women out there who have or may potentially have PCOS, because the thing is a lot of individuals actually don't get diagnosed with PCOS until their late 20s, which is when they're trying to fall pregnant and then realize that they're infertile at the moment or not being able to have a period, so they're able to produce the eggs, so they're able to produce a baby, right? So it's the most common endocrine disorder in women of reproductive age. So like I said, it affects anywhere between 5 to 15% of women. Whilst half of PCOS patients present with insulin resistance and obesity, all patients share a primary defect in androgen production. And that's one of the key things that they have in common, right? The majority of PCOS patients tend to remain undiagnosed until later in life, like I said, when they're looking at becoming pregnant, which is when they realize their reduced fertility is experienced with the issues. So the consequences of PCOS extend far beyond elevating androgen levels, hysterectomy, and acne and infertility. PCOS have been linked to conditions such as metabolic syndrome and a variety of cardiovascular risk factors, including obesity, elevated blood pressure, dyslipidemia, and so forth. But how are individuals diagnosed with PCOS? Because you may be listening to this and might be like, maybe I have PCOS, maybe I'm not too sure. How do I know? Right. So in regards to, there's a well-recognized criteria for diagnosing PCOS. It's the Rotterdam criteria, which you can look up, but essentially it indicates diagnosis for PCOS if positive for 2 of the 3 following, right? So number 1, clinical or biochemical evidence of hyperandrogenism, which is kind of associated with body hair. So essentially having hair where you're not supposed to, as women, on their chin, on their chest, and so forth. Evidence of oligoannuvolation, which essentially means irregular or absent period. So it depends on the individual. Or ultrasonographic evidence of polycystic ovary. So this is when they do an ultrasound to see if you have polycystic ovaries, right? So to see if there's any on there, right? So you need to have 2 of the 3 of them to essentially be diagnosed by a medical healthcare professional to have PCOS. And then you might be wondering, what are some of the risk factors for PCOS? Well, the number 1 risk factor for PCOS is obesity. Obesity is very common for individuals with PCOS, often central distribution of adiposity, which means mainly on their stomach, their gut, they're bloated, it's coming out of their stomach, right? Central obesity. Because it is associated with high levels of fasting insulin, LH, luteinizing hormone, estradiol, and androstenedione than the same body mass with a peripheral bad fat distribution. So what that's kind of saying is the risk factor is obesity, especially if you have more body fat around your vital organs, which is around the central, which is around the belly, right? The other one is insulin resistance. Although most women with PCOS tend to be obese, not all. That is kind of like, you can't just be like, oh, you're an obese woman, you're going to have PCOS. It's not like that. You may not even have obesity and you may have PCOS. And I know a number of women who have this. Both obese and non-obese women with PCOS are more insulin resistance. This is the key, insulin resistance, and exhibit greater hyperinsulinemia than women without PCOS of the same weight and age. So you may have a woman who is the same age, let's say 30. I sound like one of those commercials, those super commercials. Same age, 30. Yeah. So you have a woman who's the same age, same weight, right? So let's say 75 kilos, 30 years of age. Another woman, 30 years of age, same weight, one might have PCOS and one may not the other, right? So that's not really something to take into consideration. It's more the insulin resistance. So yeah, so another one is family history, stress, nutritional deficiencies, high glycemic load, sedentary lifestyle. Kind of sounds like a lot of other diseases or issues individuals have. These are the things that occur, right? Sign and symptoms. So these is most common signs and symptoms of PCOS include enlarged ovaries, generally 2 to 3 times larger than normal, resulting in multiple cysts. Irregular menstrual cycles. So this means having an irregular one or not having a cycle at all. Hirsutism, which is especially facial hair. So women who have facial hair here on their chin, on their neck, where they're not supposed to have facial hair, because men have facial hair around their beard and so forth. Women don't, not so much anyway. So if you have extra of that, then there may be an issue. Central obesity, apple-shaped obesity center around the lower half of the torso. So the little nice belly, right? Infertility, generally resulting from a chronic lack of ovulation. Elevated serum androgens, which is the male hormones, especially testosterone, androstenedione, and other ones, right? Causing the hirsutism and occasionally menstruation. So they kind of say that they look more manly in a sense. It just depends on the individual. This is out of a book, so every individual is totally different. The other thing is also male pattern baldness, also jawline acne and oily skin. Also, they can have is prolonged periods of PMS-like symptoms, so ongoing PMS symptoms. Sleep apnea is such an interesting one because it may be associated with metabolic syndrome. Chronic pelvic pain, blood sugar dysregulation, and hypothyroidism. Okay, so that's kind of like what PCOS is and what the signs and symptoms are and how you can be diagnosed with it. Your question was, what is the link between PCOS, gluten, sugar, and dairy? Thank you so much. I might take a bit longer on this question, so bear with me. I usually only do this for 10 minutes, but I might go a little bit over today just to get to set it clear and set it straight, right? So what needs to be noted is several studies have found that people with PCOS are more likely to have elevated levels of CPR, which is an overall inflammation marker, compared to those without the condition. So if you have the condition, you're more likely to have inflammation than someone who doesn't, right? This suggests that some form of inflammation is happening in the body. If you have PCOS, you may also have high levels of other markers of inflammation, such as oxidative stress, inflammatory cytokines, and white blood cells called lymphocytes and monocytes. All of these factors are involved in the immune response and they cause an inflammation, right? Inflammation in your body. If you have PCOS, right, you can start easing the inflammation with lifestyle changes, and this is why a lot of individuals are told to reduce their gluten, reduce their sugar, reduce their dairy, or cut it out overall, because these cause inflammation in most individuals. It also depends, right? So when we look at gluten, right, gluten, you need to actually make sure that you're not celiac, because if you are celiac, it's causing so many issues with your PCOS, right? So rule out that you're celiac or that you're not celiac, and then if you're gluten intolerant or so forth, because what can happen is the gluten may be causing more inflammation in your body, making your PCOS even worse, making everything in inflammation in your body worse, right? Another thing that we also have to note is that usually gluten foods are higher in carbohydrates, giving you a higher glycemic load, right? Also, gluten is known as a hormone disruptor. it may be sprayed, it may not be, depends if you're getting it organic or not, right? So more studies need to be done between the link of gluten and PCOS. However, the link with dairy and PCOS is a little bit more clearer. So most individuals have acne who have PCOS, right? And they're saying to remove the dairy. According to new research published in the Journal of Academy of Nutrition and Bioethics, showing a positive link between dairy consumption and acne, right? In the Review 28 study, the research concluded that frequent daily intake as well as high glycemic load diet contributes to acne, right? This is why dairy ingestion can lead to increased insulin level, leading to increased cellular growth of acne. Dairy products are carbohydrates which stimulate insulin growth factor 1, resulting in high insulin levels. Both skim, whole milk, and things like that have a 3 to 6-fold higher glycemic load compared to other carb foods. High insulin levels leads to increased androgen, creating more sebum production, which causes the acne, right? Milk contains growth-stimulating hormones, including IGF-1 and DHT, which increases androgen, resulting in higher sebum production and acne. And this is where the issue is with PCOS with individuals, right? So we have a clear link to there why individuals should not be consuming dairy if they have PCOS. Individuals should also maybe reduce or remove gluten if they have PCOS due to the inflammation that it may be causing in their body. Please note, this is based on an individual assumption. This is based on an overall consumption. It needs to be looked at on an individual basis, right? But the key that we need to note here is that women with PCOS are found to have a higher than normal insulin levels. Insulin is a hormone that's produced by your pancreas. It helps your cells in your body turn sugar into energy. If you don't produce enough insulin, your blood sugar levels can rise. So many issues when your blood sugar levels rise. This can also happen if you're insulin resistant, right? So if you're insulin resistant, your body may try to pump out higher levels of insulin in effort to keep your blood sugar lower or at normal levels. Too high levels of insulin can cause your ovaries to produce more androgens, such as testosterone, leading to the complications of PCOS. This is talking about a high sugar diet, right? So what also needs to be considered is the fact that women with PCOS appear to have a level of peripheral insulin resistance that is much like women with type 2 diabetes, which is categorized by 35 to 40% decrease in insulin immediate uptake. So individuals who have PCOS and type 2 diabetes are similar in regards to their insulin resistance. This is mind-blowing, right? And insulin resistance may contribute to hyperandrogenism and gonadotrophin abnormalities through several mechanisms. High concentrations of insulin reduce circulating SHBG, thereby increasing the bioavailability of testosterone. So that means there's more testosterone available for the individuals who have PCOS. What does that mean? The hair growth, what does that mean? The acne, what does that mean? The baldness, what does that mean? Issues with not having your period. Okay, they also might have severe cofactor of stimulating ovarian androgen. Yes, so essentially this is just saying what I just said in more complex terms, right? So as also acting on the liver, insulin inhibits the production of SHBG and IGF-1 binding protein, resulting in increased bioavailability of these substances in the ovary. Increased IGF-1 is secreted by these cells that act in both an acrite and panacrite manner to modulate the stimulant effects of. So essentially what this is saying is it's going to stop you from ovulating. It's going to make you have more testosterone that you need. It's going to mess up with your hormones. It's going to mess up with your insulin resistance and so forth. So in regards to your question, how does having PCOS affect, how does eating gluten, a high sugar diet, dairy affect your PCOS? Well, as you can see, there is a huge effect on your body by taking in these foods, right? Because of the insulin resistance that these individuals have who have PCOS. So what is key? It is key to have a low GI diet. It is key to reduce the sugar intake. It is key to reduce refined carbohydrates. It is absolutely key to improve cell sensitivity to insulin and reduce the resistance, right? It is key to restore your stress and reduce cortisol secretion. improve female hormone profile and reduce the androgen levels, right? Reduce cortisol and prolactin levels if they are elevated, support optimal level of your hormones in your body that is supposed to be happening, right? So I hope I shed some light to your question. I hope I answered the question in regards to PCOS, sugar, dairy, and gluten. And hopefully, so before I even end this, I want to put in there, if you reducing gluten, sugar, dairy for a month or so helps your PCOS signs and symptoms, why wouldn't you do that? Test, trial things on yourself. Of course, with a medical healthcare professional to ensure that you do it the right way, to ensure there's no adverse effects. But why wouldn't you do that if that's going to help you? The studies are saying that this is something that's going to help you. If you're looking at a client as a book, as what's happening in the book and what does the literature say, it says that this is going to help you due to the etiology of the PCOS. Of the PCOS, polycystic ovary syndrome, right? So what happens in that, by you reducing your gluten, sugar, and your gluten, sugar, and dairy intake, you are going to benefit and you're going to reduce the signs and symptoms of PCOS, right? So what I'm trying to say is here, if that is something that's going to help you, please go try it, do it, of course, with a healthcare professional by your side to ensure that you're doing it the right way. I hope I shed some light to the question for you and anyone that may be experiencing PCOS or doesn't even know they have PCOS and is now going to check and confirm this with their GP, with their medical healthcare professional. There you have it. If you have any questions, please feel free to ask me at mihaela.raguz on Instagram, and I'll be in touch with you and hopefully I'll be able to answer the question on the podcast. Remember, you are not alone in the journey to optimal health. I'm here to assist you and make your journey a pleasant one. Until next Wednesday, love you.